Normal is probably a definition that we don't really want anymore. I mean, the normal practice of pharmacy is fading away. I mean, anyone can do normal, I guess is the other way to say it, right?
The thing about Chris is that you just can't do your job, like you just do your normal kind of job. He's always asking questions like, what if we did this, or what about this? And when you're just trying to get a task done at that moment, it's kind of like, really? But at the end of the day, it's always a better outcome. It forces me to step outside the box. It's always bettering patient care.
When I first started working for him back in 1998, when I first graduated, I came into this community. He was working here, and from day one they had a team, including Chris, that was always about innovation of practice and looking forward to where the practice of community pharmacy is going to go. And he still has that to this day. And he's always looking for a new niche, a new area where we can build relationships.
Just in the last few months, we've actually integrated a medication review program that we do right in the physician's office. They've given us, I've got my own online access to their Med Access computer program, and I can take all that into account when I look at their medications. The patients then come in to see me before the doctor's appointment, and we discuss their medications.
I mean, I think it works in a ton of different ways. For the patients, it means that they're getting better care, the consultations that they get are longer and more meaningful. And I think the biggest single thing is that by working together, the patients see that we're part of a team and that they can trust him and me better.
I think every patient has their own criteria. I think you have to understand that patient, what their needs are, and how they're going to accept that. And Chris can relate to that. If he knows that you're insecure about something, he'll clarify it. And I think that's very important. He has to feel what the client is feeling, and I think he's more of a family person than, just a pharmacist.
What do you want to get out of your profession? Do you really want to see a healthy patient outcome? Do you want to see improved relations with the healthcare? Do you want to see, there's a multi-level to our profession nowadays, right? When you get down into the trenches and you really deal with people on a personal level and integrate their healthcare and see a positive outcome, that's when it's rewarding. When you're dealing with one person sitting in front of you, you're probably dealing with 10 people, right? Because they've got brothers, sisters, moms, dads, sons, daughters, the rest of their healthcare team, and you got to know that every bit you do helps numerous people. So